Today we will talk about the calcium CT score, that is, why it is called a calcium CT scan and what it actually is. The calcium score CT test, or CAR-C, coronary artery calcium CT scan, which is commonly referred to as the calcium CT score test, is a painless imaging method performed without any discomfort to the patient, which examines the coronary arteries or vessels of the heart. It is done to measure or assess the amount of calcified plaque. In the blood vessels, that is, the arteries, there is a hard, plaque-like substance called plaque. This plaque is a compound made up of fatty substances such as cholesterol and other similar things, which over time becomes harder, that is, it becomes calcified. The measurement of this calcified plaque or deposit, the presence of this plaque or the percentage of how much of it is present, does not directly indicate coronary artery disease or CAD, but it is a strong indicator of the risk of a future heart attack. It also gives cardiologists an idea of the potential risk of heart disease and stroke. The procedure or method for this test is done without causing any pain or discomfort, and during the test, there is no pain of any kind during this test. For this test, there is also no need for a contrast dye injection. The CT scan patient is made to lie down on a table, which then slides into the CT scanner. This scanner is a large donut-shaped machine. After the patient is positioned, electrodes are attached to monitor the heart's electrical activity, that is, to keep an eye on the patient's ECG. To keep an eye on the patient's It helps to take images, that is, photos or pictures of the patient. This means that when the patient's condition is not improving, it helps to capture a clear picture of that moment. It ensures or makes sure that the image or picture is taken properly. X-rays are used for taking these pictures. The scan itself only takes a few minutes, and the entire procedure can take about 10 to 15 minutes. The patient is asked to hold their breath. To hold it, results. The calcium score is a type of CT test that shows a calcium score. This means it is a number that indicates the percentage of calcified plaque present in the artery. It tells you exactly what percentage of calcium is there. The most common scoring system is called the Agatston score. It is called the scoring system. A score of 0, having a score of 0 is the best. In this specific scenario, where there is absolutely no calcified plaque present within the arteries, and for a certain significant period in your life, it clearly indicates that you have a very low overall chance of experiencing a heart attack. Furthermore, receiving a score ranging from 1 to 100 shows that there is only a small size or a minimal amount of plaque buildup, while the immediate risk of developing heart disease remains relatively low. It does strongly indicate that making certain lifestyle changes and other precautions, such as adopting a healthy and nutritious diet and similar improvements, should be implemented. A score from 101 to 400 indicates moderate plaque, meaning a medium size. This suggests a higher than average risk of heart attack. Usually, doctors prescribe a medication called statins to prevent the plaque from increasing further and to slow down the growth of the plaque. Can be reduced. A score above 400 indicates large-sized plaque. This is a sign of severe disease and carries a very high risk of heart attack. For this, further testing, as well as additional treatments and medications, become necessary. Such patients always require the supervision or guidance of a cardiologist. For whom is this test necessary? The calcium CT score test is generally recommended for those people who have risk factors for heart disease but have not yet shown any symptoms or complaints. What are these risk factors? First, the presence of heart disease itself. Second, a family history of heart disease. Third, high blood pressure. Fourth, high cholesterol. Fifth, diabetes. Sixth, tobacco use. Seventh, being overweight or physically lifestyle. This test is most beneficial for people who are at a moderate, that is, an average risk of heart disease, because it can help doctors and patients decide about starting preventive treatments such as medications called statins. This test is generally not performed on people who have already had a heart attack or have been diagnosed with coronary artery disease, because this test will not provide any new useful information for planning their treatment. The use of the calcium score is valuable and beneficial for people because it can help both in treating heart disease and in preventing its progression. Let us know in the comments how you liked this video, and if you enjoyed it, please like and share it. If you haven't subscribed to our channel yet, do subscribe right away so that in the future you can stay informed about upcoming updates.